Good morning.
Good morning.
Welcome to Daily Dose. We are waiting on our guest, so we're going to get started and hope that Senator Tim Mathern can join us. I'm not exactly sure what's going on, but sometimes technology trips you up. So if I look cagey, if I keep doing this, it's because I'm checking to see if he has checked in with us.
And if I do that, it's because I forgot the camera's up there now. We're not down here.
Yes. So while we're waiting for Senator Mathern to join us, I wanted to talk about the fact that this morning, all month long, I have been doing daily gratitude posts, which I do almost every November. I've been doing them on my professional Dana Del Val page. And today's post was about all the guests who've showed up. Oh, there he is. We'll talk about that later. I'm going to let Senator Mathern in because I'm thrilled he's here.
Me too.
Senator Mathern.
Hey, good to see you.
Hello, good morning.
Good morning.
Thank you for figuring that out. I'm sorry, it was a little bit of a trip. Sorry about that. How are you?
I'm doing well. I had some technical difficulty with the computers at work and all kinds of things about confidentiality. So I'm on my phone with you.
Yes.
Of course you did. Well, thank you for figuring it out. We appreciate that. So, Senator Mathern, will you please just give us quickly your background, because you have an impressive resume for why you're on today talking about policymaking around addiction and treatment of addiction.
Well, I began my career as a social worker some almost 50 years ago.
Wow.
And my work was helping individuals solve their personal problems. And it wasn't too many years into the process where I thought, well, I need to get better at this. So I got a master's degree after the bachelor's degree. And then after I had the master's degree, still work with people. And I finally came to the conclusion, most people, if they have problems, it's not a matter of individual failings. It's a matter of how we organize society and oftentimes create a situation where people have personal and social problems. And so I got involved in politics. It is in politics, in public policy, that we figure out how the world should be ordered and how it should be set up to support individuals and families. And I've been doing that for 35 years and just came back from the North Dakota legislature where we apportioned $1 billion to address the economy in our state. So that's my background. I presently work also at Prairie St. John's Hospital, in addition to being a state senator. And I've worked in the past as an administrator at a social service agency, Catholic Charities, and I've been an administrator of a church. And right now am very involved in the exciting process of building a new hospital at Fargo.
It's incredible what that facility is starting to look like compared to where you have been working. You're in a very old building, one of the original hospitals in the region, right?
Yes, and in fact, it's a good example of discrimination against a certain illness and behavioral health. Almost all behavioral health facilities are in older buildings or buildings that medical care institutions have abandoned.
Yeah.
And to me, it's an expression of what's going on in society, wherein we don't accept behavioral health issues as health issues. It's one of the last places of discrimination in terms of healthcare. We used to put people away at different colonies and different buildings who had healthcare problems. And you can start way back from biblical times to now. And this is just another example of this discrimination in our society when old buildings and sort of secondary care is provided to people who have behavioral health issues.
Boy, I had never thought of that. And you lived there for 4.5 weeks. Did you think of that?
I did think of that, and it was addressed by a couple of my counselors too.
What did they say about it?
They just said that they were talking about a potential building. They said this place was kind of, I think the phrase one of them used was where it's all been held together by duct tape and glue.
Sure.
But it didn't stop them doing a fantastic job,
Well, that is true. I mean, there is value, obviously, in new and updated and in places that say to someone, you have value, you belong here. I mean, if you think about birth centers, for example, birth centers today are like 5-star hotels. Holy buckets. Senator Mathern, I think I've told you this, but my son was one of the last babies born at Prairie St. John's before that transitioned away from being sort of a regular hospital and became the mental health facility. So I remember having him there and knowing that not too far down the street, were 26 years ago almost, at the time, very, very high end. Now those look kind of like Super 8s compared to Ritz's. It's incredible what birthing centers have become. So your point about how we value some kinds of healthcare and don't value other types and people who use those services is something I've just never ever thought about, but really, really important.
Yeah, it certainly is.
I would add right now we have a public policy issued before us, and that's whether or not we build a new state hospital.
Okay.
The state hospital is in Jamestown, and I believe it would be a mistake to build a new state hospital because it takes this concept of discrimination about one illness into the future, another 100 years. I mean, a state hospital was a central institution where you could sort of send all of these people that communities didn't want, or communities didn't want to take care of, or communities didn't know how to take care of. And the new model of care is really that people need care in their own community. And staying well, staying free from substance use, or being able to manage a mental illness really depends on the community. It depends on the supports that people have. And if you take people away from their community and you put them in a central institution away from those connections, their employer, their family, their church, their community, it's hard to stay well. And because the person grows at a different rate than the other people do.
Yeah.
And it's hard to keep that together. So I believe we need treatment facilities in many places around the state. And so right now, I would just encourage you and the citizens to think about this and contact your legislators. Do you want a brand new state hospital, or do you want treatment facilities all over the state?
So
that is very interesting.
Yeah, you are my senator. You are our senator. So I guess we don't have to contact you.
You may sway us on this one.
But let's talk a little bit about that point. And we'll just remind the audience that we can see questions coming in from YouTube, LinkedIn, or Facebook, however you're watching this. So if you have questions for Senator Mathern, either that are specific to North Dakota policy around this, or maybe just policy in general, since I think it's fair to call you a policy wonk, isn't it, sir?
Sure.
Sure.
It's an
So,
interesting
so
term.
I think you can send in questions if you have them, and we'll see what the senator can answer. But let's talk about this idea of being a citizen reaching out to your legislature, your legislators, in terms of these issues and really anything else. Because I think when you ran for governor, I helped with that campaign just a little bit, and I remember feeling like so often people don't reach out to the people who are making their political choices for them for a lot of reasons, some of which are fair and some of which are assumptions. But what is that relationship that you would like to have with your constituents, and how might people get over the sort of fear and anxiety of talking to elected people? That's kind of off topic, but I think it's important as we talk about how someone might become an advocate for mental health or addiction treatment or all those kinds of things.
Well, thanks for the question. I believe that there's been a mega change over the last 50 years, which has not been helpful for that concept. I think there was a time when politics was quite local, and people voted based on kind of their relationships with their local legislator. But it's changed considerably to politics being national, where, you know, like in the last presidential election, you were either for Trump or for Biden. And so you were an R or a D. And that then influenced people down the ballot. So I think what's important is we try to reconstruct that to, there is this national thing going on. It's important to take part, but it really is different than local politics. And we need to connect with that. And I think social media and the news is so wrapped up in the national part, it's hard for citizens to separate. So in North Dakota, we have 47 legislative districts. And that means, like in Cass County, we have 10 districts. So each citizen has 3 legislators, a senator and 2 House people in their district. And it's really not impossible to literally call them.
Right.
Like on the telephone or email them to express a concern. And
as far as to be able to text them.
Yes.
I just texted you this morning, I think. So, yes.
I'm talking about the younger ones who don't know how to use a phone. They use it to text people.
And everybody's contact information is available at legis.nd.gov. That's legis.nd.gov. And there's a list of all of these senators and representatives, what district they're from, their email, the contact information. So I just think it's important that people know how to do it. But I think you're probably speaking to the motivation.
Yeah.
And I would just say, just like your program, you're educating people about this specific area of public policy, and you're focusing on the transformation of people and their families to deal with addiction. But it's a matter of just kind of ratcheting that to another level. When somebody has addressed the personal issue, how do you ratchet that? Maybe I would say ratchet it up to public policy level. It's still the same thing.
Yeah.
But it's just a little different level, a different layer of the onion. And without that public policy involvement, we don't create a world wherein we have ways to treat these issues and ways to actually prevent them.
Sure.
And I'm a little bit afraid that we're going backwards. We just announced our country has had 100,000 deaths in overdoses.
I saw that yesterday. Isn't that unbelievable?
Yeah. And so there are underlying conditions that get us to that number.
Yeah.
And those conditions must be addressed by public policy.
Yeah.
Yeah.
Senator, we have a couple of questions. I want to be sure and get to them. I'm going to put them on the screen. So Bonnie's wondering, what is the take of maybe your constituents regarding rebuilding the state hospital? What are you hearing across the state as you are meeting with your colleagues and with your voters?
I think most people want to build a new state hospital.
Yeah.
Many legislators do. The governor does.
Oh,
It's a simplistic solution to a complicated problem.
right.
Yeah.
And I'm afraid that's where many people gravitate.
Yeah.
And,
Well, it's
and it's an uphill battle to go to this new frontier of saying, you know, we don't have a state hospital for prostate cancer. We don't have a state hospital for breast cancer.
No.
Why do we do this for this illness? But it takes a change of mind, and it's difficult. And I would say right now, if this was voted on right now in the legislature today, we'd probably build a new state hospital.
sure.
That's a shame.
However, we do have a committee, acute care committee of 8 legislators studying this in detail.
Okay.
And hopefully, if enough people express their concern about local treatment, that committee could come out with a different recommendation. But right now, bottom line is that what was there, it would be built.
Sure. What's the timeline on this? Is there one?
Well, we are working on this in an interim committee fashion right now, and we hope to conclude our recommendations by August of 2022, and
Okay.
then the legislature in 2023, starting January, would make that final decision and would appropriate dollars accordingly.
Interesting. So you have a question.
I do. Well, I can see both sides of this whole thing. I can see that maybe a localized hospital for the state would make some sense, but I also completely see the need for local care. And one of the things I was just thinking about is when I was at Prairie St. John's, all right, I was 47, but I wasn't the youngest. I wasn't the oldest person there by any means. And there were children there, basically.
Yeah.
And a lot of the younger people, and at least one of the older persons was saying in all of our meetings that they felt alienated because they were so far from home. And I thought about it, and I thought, yeah, I live in this town. I know if I walked out of this, I know exactly where to go to. It's a 15-minute walk to my home, and that, now that I think about it, made me feel slightly better. Because I was on familiar ground.
Yeah.
And I think that is important to treat any illness.
It is so right on. You know, we have people from hundreds of miles away come for treatment, and the state hospital does.
Yeah.
And they might come to the state hospital in almost a catatonic state, or maybe a very violent state, or a very or state in the middle there. And within 7-10 days, with really clear medication and a clear structure and a clear method of communicating with a treatment professional, people stabilize and get well and can leave. However, to stay well, to be connected with the supports is the challenge.
Yeah.
And if you step off out of the hospital and you get into a car that takes you 150 miles away, and all of the people at that 150-mile away destination have not taken part, I think people are just feeling they're in a twilight zone.
Yeah.
Yeah, I can see
Boy.
that.
And like you, Dr. Mathern, I mean, you could literally walk out the door, walk to your house.
Yeah. And that made me
And there
feel
were
better.
people there, and I suspect there were people at your job that knew what was going on, and they could welcome you back. And so that helps us keep well when we have supports.
Well, because if you go to a place and then you go home, you're isolated when you get home. Then then you've got very little chance of being able to successfully deal with your underlying problems there.
Boy, that is a really illuminating point that I had not thought of. Wow. Okay, we're going to move on to the next question, which is long. So I'm going to post it and then we'll look at it and we'll see what you can do with it. This is from a former guest named David Whitesock, who's a North Dakota, South Dakota, longtime resident native and now living in upstate New York, working in alternative rehab ways and treatment ways in his own journey, which is really incredible. So I'll read it out in case anyone can't see it. Question for Senator Mathern. Hello, sir. Commercial payers are having a difficult time implementing value-based or outcomes-based care and contracts. Incentives don't seem to be aligned yet. North Dakota has done some outcomes-based contracting for SUD and peer support. How can the state take this to another level so that the commercial payers will almost be compelled by the market forces to shift from fee for service? I hope that question makes sense to you. I would not be able to answer it.
SUD providers, he's talking about substance use disorder providers.
Great.
And we have many of those providers in our state, but the funding for those has really only started in the last few years. We have what's called an SUD voucher, which means a person who needs that care can go to any provider to have that care provided. But the measurement of outcome is still early in its development. And I think one of the base problems is a discrimination again that happened when Obamacare started, the Affordable Care Act in 2010. I don't know if most citizens are aware of this, but huge amounts of money during that bill and following that were provided to healthcare providers to develop electronic healthcare records to track what's going on. Well, the behavioral health facilities got $0 out of that. So behavioral health care facilities, including substance use disorder facilities, never upgraded, never had the money to upgrade the data keeping and comparison services that are needed for what David is talking about. To really do outcome-based, you need to really track when someone got into care, what was provided, how did that relate to other providers, what was the outcome? Because a lot of times a treatment for an individual, it might start at acute care in a hospital, it might go to residential treatment, it might go to outpatient, might go to some sort of medical intervention for medication. Well, that needs to be tracked properly. And so that is not properly in place yet. However, there is some tracking being done. We now have incented some substance use providers to have better systems, but we are a ways off, and we need the support of government policy, of insurance regulation to actually make that change. And we are only in process.
So, Senator, you and I are in agreement on most political pieces, not all of them, but many of them. But we are in the vast minority Well, I guess I can say you now too, because you can vote.
Yes.
We are in the vast minority now of our state and in some cases, much of the country. So how do you, as I'm listening to you talk about, we need federal resources, we need investment from the government, those kinds of things. I think we agree with that. But how do you have this conversation with the people who say, that's just more of a handout. That's just more big government stepping in and taking care of things. These people just need to pull themselves up by their bootstraps and figure it out. How do you talk to those people? Because you don't need to convince us. We're on the same side. How do you convince these other ways of thinking?
Well, there's a few ways. One is you try to personalize the situation and try to find out who else in their family might be dealing with this. I know many times people don't come to this awareness of need and response until they personally or somebody in their family has dealt with the situation.
Yes.
So that's one way. Another way is just to look at, there's other data forms. For example, what's happening in business, what's happening with my employees, if there is substance use disorder or mental illness, and the negative consequence of that. I talked, a related topic, I talked with a businessman the other day about COVID vaccinations. And he said on one project, this is in Fargo, over the past few months or the past few weeks, he has lost $300,000 because of employees being gone with COVID and then not meeting this guideline or that deadline. And so he's come to the conclusion he's going to require vaccinations from his employees so that he can keep his business going. Well, anyway, so he's expressing, and he would be somebody in the Republican column, somebody in the column of noting less government regulations. He's noting in his own business that he has to have some sort of regulation to make it possible to continue. So that's another way, looking at our industries, looking at our businesses, and finding out that there's a number of people who understand from the business point of view that if their employees are not well, they will not succeed. So that's another approach. I think another approach is trying to spread the message of this being an illness, a healthcare issue, a situation where there are some social determinants. So we take it out of the realm of 1965 when Medicaid was passed. Treatment of mental illness for a person between 21 and 64 is still not a covered service. And why is that? Well, some people thought, well, these people are just lazy, or these people are possessed by the devil, or these people are immoral, or these people make improper judgments. And we are finding out that there are hereditary factors, there are chemical factors in the brain, there are social factors, there are environmental factors. I mean, downtown Fargo, we got a bar on every corner almost now.
Yep.
And it's sort of hip to start a brewery and a winery and a whiskery or whatever. Well, that's a variable.
Yeah.
But anyway, so trying to help people understand that those individuals that deal with these issues personally are in a context. And that context probably contributes maybe more than some individual's decision to drink or not to drink, to have depression or not have depression. So I think explaining it as being within a broader context. We don't tell people who have diabetes, get over it. We don't just bring them in the hospital one day and say, we fixed you.
Yeah.
Yeah.
You know, people with diabetes for their whole life have to do certain things. And we accept that as it's the same way with mental illness or substance use disorder. It's a lifetime addressing the issues. And so I think explaining that to people is important, and explaining that to families. I think of it often too when you see or somebody says so-and-so committed suicide. Well, we don't say that when somebody died of cancer.
Yeah.
You know, they committed cancer, committed suicide. You know, there's so many factors,
Yeah.
and it's not really a decision on one person's part to do this one thing. It's a combination of issues we are all responsible for. It's really not just that individual. So that would be the final point I would add, is just kind of educating our friends and neighbors and family members about the broader range of responsibility and response to this situation.
Well, that's really lovely. And clearly the reason that you are in an elected position and someone like, say, me is not, because your compassion for those who do not think the way that you do is admirable. I want to put this up just in the interest of disclosure, in case anyone doesn't know this. This is my mother, but she doesn't vote for you because she lives in Minnesota. So it's an outside perspective, but we are lucky to have
Yes.
you. The state is lucky to have you. You have done this work for a very, very long time. And boy, you want to talk about an uphill climb. I have sat with you in Bismarck and seen what it's like to be on this side of the political aisle, and it is no easy thing. So thank you for your service. Thank you for your thoughtful response. And thank you for the work that you have done, I think, just to spread compassion. You are a practicing active Catholic, and I feel like you bring that core belief to this work in the finest of ways. So thank you for that.
Well, I thank you for the comment, and I thank you, both of you, for your work in part of this. I mean, it's another layer of the onion. It's making sure that the wider society takes part, and that's how we make good decisions. And we need to keep working on it. Probably will forever.
Yeah.
Yep, that's probably true. Senator Tim Mathern,
Thank you very much.
Thank you for joining us. Thanks for sharing your personal and policy-making thoughts on this. It's really been an incredible half hour, and we appreciate your time and your insight.
Thank you. Have a good day. Bye.
You too.
Thank you. Bye.
Everybody else, we will see you next Tuesday. Have a great weekend, and thanks for tuning in. Talk to you soon.
I like that dude.
Bye.
He's a real deal.